Good morning. It's a rainy and cold Monday here in Michigan. We're going to do something kind of cool today. We're going to start by looking at a patient whose main concern is that she had, believe it or not, a second pair of buttocks on the front of her tummy. Yes, a second pair of buttocks on the front of her tummy. So we're going to follow her entire course today. We're going to start with how she looked before surgery. We'll bring it to the OR to look at her procedure, and we'll show you how she looks 2 months after. So she is a 54-year-old mother of 3 who had a lot of extra skin of her tummy from the pregnancies, and she followed it up with multiple operations that left her with a scar coming up and down her tummy. And yes, it does look like she has a second pair of buttocks on the front of her tummy, and that's exactly what she came in complaining about. She said, "Dr. Youn, I've got a second pair of buttocks on the front of my tummy." So we're going to perform a tummy tuck surgery to remove all that extra skin, leaving her with a hip-to-hip scar and a small scar around her belly button. And it's going to be worth it because we're going to get rid of all of this excess skin and her front butt. Here are her markings. And so we're going to make an incision that's literally going to go from hip to hip. We're going to lift up all the skin and the fat up all the way up to the bottom of the breastbone. We'll set her up in surgery, pull all of this down, and the goal is to get rid of all of that extra skin. I'm also going to do just a touch of liposuction on the hips out here and out here to help contour those in. But the big thing is let's get rid of all of this for her. So I think she's going to be really happy when we're all done with that. So let's go ahead and get started with the operation. Okay, so what we've done is I have lifted up the skin all the way up to the, we call it the xiphoid, the top of the abdomen. Done some liposuction of her hips to contour those in. And we've also pulled the tummy down. You can see this is all that skin that we are going to take off of her. I made also a marking where the belly button is going to come out as well. And she had a couple little hernias that I fixed on the inside while we were at it. So the next step is let's take all this skin off. We'll pull out the belly button and show you how it looks afterwards. We're all done, and we were able to remove all that extra skin. She does have a little scar around her belly button, and obviously you can see the hip-to-hip scar that she has. She has a little drain, and that'll come out anywhere between 3 and 6 days later. And so if you can see, she's got a much nicer contour. Her tummy's going to be very nice and flat when all is said and done. And we'll follow up with her in the near future here so you can see how she looks as she heals. All right, we are now just over 2 months out from her tummy tuck, and you can see she looks much flatter than she did prior to surgery. Her scars are still healing. That's why you see a little bit of redness around her belly button here, and that's going to take anywhere from 3 to 6 months more for that redness to go away. She does have a scar. It does go underneath her underwear from hip to hip. Once again, that hidden scar tummy tuck that I've talked about before, and you can see just how nice and flat. Now she is swollen, and the swelling all through here is going to come.
Okay, I have the Feel Good Friday winner from last week. Congratulations to Karen Lee. You have won the Youn Beauty Retinol Eye Cream. Make sure to send us your address so we can ship that out to you. And everybody else, thank you so much for all the great compliments you left Michelle.
For your holistic plastic surgeon tip of the day for today, I'd like to encourage you to check out your levels of vitamin D. Talk with your doctor because so many of us are deficient in vitamin D. And just taking a simple supplement like 2,000 IU a day if you are a normal-sized adult can definitely be beneficial. And that's especially important on days like today here in Michigan where there is absolutely no sun at all. Well, that's your holistic plastic surgeon tip of the day for today. I'm Dr. Anthony Youn, America's holistic plastic surgeon. Have a great day, everybody. We'll see you tomorrow.